Okay, everybody, Dr. Rafich here from Vet Triage. We are going through this issue of JAVMA, May 2014, comparison of rectal and axillary temperatures in dogs and cats. And these studies are really cool because it's a very common scenario in clinical practice, and we also use it a lot in virtual care as well. So we'll see how this study goes. This comes out of the University of Pennsylvania and Michigan State University, both veterinary schools. The objective is to compare rectal versus axillary temperatures in dogs and cats, a prospective observational study, 94 dogs, 31 cats. The results showed that axillary temperature was positively correlated with rectal temperature in both species. And by the way, for those who don't know what axillary temperature looks like in animals, this is what we're talking about. We place a thermometer in the armpit region. That's what axillary means. The median rectal axillary gradient or difference was 0.4 degrees Celsius or 0.7 degrees Fahrenheit in dogs, and 0.17 degrees Celsius or 0.3 degrees Fahrenheit in cats. The sensitivity and specificity for detection of hyperthermia with axillary temperature were 57% and 100% respectively in dogs, 33% and 100% respectively in cats. The sensitivity and specificity for detection of hypothermia were 86% and 87% respectively in dogs, and 80% and 96% respectively in cats. Body weight and body condition score were correlated with rectal axillary gradient in cats. Notice that they use the word hyperthermia and not fever or febrile. Having a fever is a different scenario than having an elevated temperature. All febrile animals are hyperthermic, but not all hyperthermic animals are febrile. Conclusion was that the axillary temperature should not be used as a substitute for rectal temperature. Introduction. In human studies, there's a wide variation between axillary and rectal temperatures in adults as well as pediatric and neonatal populations. The sensitivity of axillary temperature for detecting fever ranges from 25% to 87.5%, with an increased sensitivity in neonatal populations. Patient age, body condition, time of day, axilla of measurement, and the presence of hemiplegia affect the reliability of axillary temperatures, whereas intravenous fluid infusion, environmental temperature, and the amount of clothing worn do not. Weight, body condition, breed, and coat length are associated with differences between axillary and rectal temperature in dogs. In humans, the gradient between core temperature and the temperature of the great toe correlates with the severity of circulatory disease, and increasing temperature of the toe in response to treatment is associated with an improved prognosis. Materials and methods. These cases were collected between November 2011 and June 2012. Hyperthermia was defined as rectal temperature over at least or greater than 39.4 degrees Celsius or 103 degrees Fahrenheit. And hypothermia was defined as a rectal temperature of less than 37.8 degrees Celsius or 100 degrees Fahrenheit. The results, canine data. Axillary and rectal temperatures were positively correlated, although the median axillary temperature of 38.4 degrees Celsius or 101.1 Fahrenheit was significantly different from the median rectal temperature of 38.9 Celsius and 102 Fahrenheit. The sensitivity for detecting hyperthermia in dogs with axillary temperature was 57%, and the specificity was 100%. Hypothermic dogs had a sensitivity for detection of hypothermia with an axillary temperature was 86% and a specificity was 87%. For the cats, axillary and rectal were positively correlated. The sensitivity for detection of hyperthermia for axillary temperature was 33% and the specificity was 100%. The sensitivity for detection of rectal hypothermia with axillary temperature was 80%, and the specificity was 96%. Among the physical exam variables, weight and body condition score in cats were significantly associated. All right, discussion. Results of this study indicate that there was a large variation in axillary temperature compared with rectal. Axillary temperature was not considered a reliable surrogate for rectal in dogs and cats. The axillary temperature had a high specificity of 100% for detecting hyperthermia based on rectal temperature in both dogs and cats. Although all animals in this study with increased axillary temperatures were truly hyperthermic, axillary temperature should only be used as a screening test for hyperthermia with caution because the sensitivity for detecting it was only 57% in dogs and 33% in cats. In other words, the results here suggest that animals with a high axillary temperature are most likely truly hyperthermic, as determined by rectal, but an axillary temperature within reference range does not rule out the possibility of hyperthermia. In humans, the increased core body temperature leads to an increase in the variability of axillary temperature. 1 second, guys. Okay. Axillary temperature had a moderately high sensitivity and specificity for detection of hypothermia in dogs, 86% and 87% respectively, and in cats, 80% and 96% respectively. This suggests that animals with axillary temperatures in the normothermic range are unlikely to be truly hypothermic. But an axillary temperature in the hypothermic range does not rule out normothermia, as indicated by rectal temperatures. An increased amount of axillary fat may lead to insulation of the thermometer from the core body temperature and thus greater variation. There is no significant difference found in dogs with shock compared with dogs without shock. In humans, the gradient between core and peripheral temperature increases with shock, and monitoring the temperature gradient is a useful clinical tool for evaluating treatment and resolution of shock. It has been suggested that axillary temperature is expected to be lower than rectal temperature, yet 14% of dogs and 39% of cats had a higher axillary temperature in this study. Rectal temperature measurements can be affected by fecal material, rectal inflammation, thrombotic conditions, peristalsis, muscle tone, and physical activity. If some of these variables cause lower rectal temperatures in animals in the study, the result may have been the higher axillary temperatures found in some animals. Rectal temperature also lags behind changes in core temperature in humans by a mean of 15 minutes. In one canine study, rectal temperature was higher than pulmonary artery temperature in 63.6% of readings. The time of day at which the temperature is measured has been associated with differences between rectal and axillary in humans. The limb of intravenous catheter placement and fluid administration was not noted in this study. However, in human neonates, intravenous fluid administration does not affect axillary temperature. So yeah, I mean, the axillary temperature still has its place, of course. It is a good rough estimate, but obviously, I would assume it's common sense that clinically speaking, if everything else is equal and you have a choice between rectal and axillary, we're all going to go for rectal temperatures and not axillary. We only use axillary for situations where the animal's temperament doesn't tolerate rectal, or it's got a disease back there in the hiney and won't tolerate it, or you can cause more trauma that way by doing a rectal. If a pet owner is monitoring temperatures at home, then certainly axillary will be a better way to go. So it makes sense that it's not the ideal replacement for a rectal temperature, but it still seems like it's good enough in the appropriate cases. But we do need more studies on that, assessing all these other variables and a larger number of animals. All right, we'll see you guys tomorrow. Thanks.